Southeast Radio's Business Matters with Karl Fitzpatrick.
Southeast Radio.
Welcome back to Southeast Radio's Business Matters with me, Karl Fitzpatrick. When we hear about hospitals in the news, more often than not, the headlines are dominated by waiting lists and a shortage of hospital beds. But what is the reality of running a public hospital like? Lily Byrnes, the General Manager of Wexford General Hospital, joins me now to tell us more. Lily, before we discuss your role as General Manager in more detail, I'd like you to tell us a bit about your own background.
My own background, Karl, is in the public sector. I began my working life in Dublin County Council. I then worked in St. Senan's Hospital for a short period, and then I went back to the Wicklow, Dublin area and worked in both community care and in care of the elderly hospitals. And following that, I spent a number of years in HSE Corporate Centre in Kilkenny working as the Employee Relations Manager for the then South Eastern Health Board, and it was following there that I came to Wexford General Hospital a number of years ago.
So perhaps you can provide us with an overview of what the role of a General Manager of a public hospital entails.
I suppose the role of the General Manager is the person who is the accountable person and the person who's responsible for all of the functions of the hospital, including patient access, quality and safety, human resources management, finance and estates.
There's huge responsibility, of course, with that role, but in relation to the relationship with the HSE, how does that work?
I suppose Wexford General Hospital is a statutory hospital, so it's part of the health services under the Health Act. So we report through a formalised structure to a CEO who reports to the Director General of the Health Service Executive, ultimately to the department and the Minister.
So I'd be very interested to hear about your own management style within the hospital.
I suppose because of the varying responsibilities, it varies. I suppose you talk about autocratic, democratic and laissez-faire. It's certainly not laissez-faire. I try to be democratic, but there are, in the sense that I try to be out on the floor, meet staff, and that we make decisions as broadly as we can. But there are times when you will be autocratic and you make a decision, and that comes with the role, and you stand over that responsibility.
And of course, a huge element of your role is resource management. So how do you ensure that there are sufficient resources in place?
It's a challenge year on year, and obviously the hospital receives a budget every year, which in general is a roll-on from the previous year with some additions. So you're constantly planning for financial resources, for human resources, for infrastructure, to make sure that you're looking ahead all the time, putting in business cases to seek additional funding, but also addressing issues as they arise. And that will be, things from a technical or maintenance point of view to approve repairs or to, purchase equipment, down to approving agency staff or an employment where you need somebody. So it's constant. You have an envelope of funding and you're required to deliver your service within that. I attend financial meetings every month where there is oversight of my budget and I'm accountable for it. But ultimately with the support of a finance manager and everybody having, I suppose, a consciousness within the hospital of that we have to deliver our care, but we also are conscious of, scarce resources, that we manage it throughout the hospital. But it is a challenge to deliver services within resources to the standard that we want to deliver them.
So if you require additional financial resources, what's the process that you need to go through?
I need to quantify what I need to validate what I need to cost it correctly, and then I have to make a submission through my CEO and the Director of Finance within the hospital group to seek additional resources to deal with the challenge that I have. If it's a matter of estates or capital, for example, if something major happens within the infrastructure of the hospital, then I would go through that route, but also through the HSE estates to, I suppose, make the case that I am a priority and that I need resources for the particular event that's happening. And sometimes you simply have to manage as you go and deal with issues as they occur.
And Lily, in your role, I'm sure that decision making and problem solving are an everyday occurrence. But what process do you apply to problem solving?
I suppose within the hospital itself, both in clinical areas and other areas, we would use a lot of algorithms and decision tree processes in around how they would solve them. In terms of when issues come to me, either on a daily basis or something that may be over a longer period of time, we look at the data. There was a huge amount of data, in fairness, available because all our data is monitored and drawn up all the time. But we look at the data. I talk to the senior managers to get their views of it, and then we try and come up with the best solution on the evidence that we know know of, our experience of this particular issue or other issues or outcomes. Or sometimes you will have a decision where you simply have to make the best decision in your experience on the day on a very short, amount of data. But where possible, we're looking at data the whole time, trying to think ahead, and then we make decisions on that.
And how would you describe the relationship between the medical and non-medical teams in Wexford General Hospital?
They would be good in Wexford General Hospital because we would have been one of the first hospitals to go down the route of clinicians in management, and that was around looking at, that doctors become involved in management in clinical areas, and we base it on multidisciplinary teams. So we're quite used to people working across disciplines, and a lot of our teams are multidisciplinary teams across the clinical areas. And also when we have a change to make, for example, when we had our hospital, we got capital investment to put in new fire prevention measures a couple of years ago, and we had to move wards and move people around. So we put together teams during that time of everybody who would be involved. So they were very multidisciplinary teams, and that helps usually to develop good working relationships.
And what type of culture exists currently in Wexford General Hospital?
On the basis, I suppose the most validated answer to that would be the results of the Your Opinion Counts, which was the Health Sector National Staff Survey in 2018. And in that survey, Wexford scored marginally above other hospitals. For example, in job satisfaction, the national response was 64% satisfied. We got 67%. For motivation, we got 76%. The national was 55%. For optimism about the future, we got 77%. The national being 70%. And trust, we got 90% against 89%. So while there will always be issues and there's always work to do, that was our result, and that is gratifying.
And in terms of safety standards, how do you maintain appropriate patient and infection prevention and control standards?
I suppose we have a number of standards that we are required to work to. Most importantly would be the HICWA Safer, Better Wellcare standards, and that would cover infection prevention and control. And we have a team within the hospital. We have a nurse lead, a microbiologist, and we work across wards and all clinical areas with hygiene audits, with hand washing practices, with our pharmacy supporting antimicrobial stewardship, advice to consultants on prescribing. So it's a very active part of the hospital. It's monitored monthly, and we submit data to the HSE on a monthly basis, and that data is reviewed, and then if there are issues, they're fed back. If we have an outbreak of winter vomiting or any of those things, we have a process that we follow. We report all the cases. We link with public health. So there are a number of mechanisms in place to support that we maintain a high standard with that. And thus far, we are a hospital with all of the challenging infections that are out there at the moment, that we have so far not had an outbreak of some of the more challenging infections in Wexford. But it is a continuous work in progress. Patients who come into our ED department oftentimes are isolated there for a period of time, but that's because we have single rooms, and that's to ensure that nobody is exposed to a hospital-acquired infection. So we work very hard at it. It's continuous vigilance on a daily basis.
And of course, patients on trolleys is something that makes headlines time and time again. How do you deal with this on a day-to-day basis?
It's responding and planning ahead. We have an escalation plan which identifies where we can put additional patients in the hospital in agreement with staff, and how we're going to resource and look after those patients. So we then look at monitoring at the numbers that we're going to admit each day and the numbers that leave. And if you look at our trolley numbers in 2018, they were very low in comparison to now. And the reason for that is that we've had a 20% increase in presentations at the hospital, and our admissions have increased. But in order for patients being admitted to the hospital to get a bed, we need to have an available bed. And that means the patients who are leaving the hospital need to have some place to go to. They need a home care package. They need support at home. They need a nursing home bed or people to be in a position to care for them. So it's a whole cycle, and it really is a demand and supply issue. The demand that's coming in at the moment is greater than the supply for patients to be discharged from the hospital. So we work on a daily basis. We have what we call a navigational hub, where each morning we look at who's coming in, who's going out, and what steps within our control we can take that day to make as many beds available for incoming acute patients as we can.
Now, I know that in some parts of the country, Lily, there are issues in relation to readmittance of patients following discharge. How much of an issue is that here in Wexford, and how has it been dealt with?
We are within, again, there are a huge number of key performance indicators nationally that hospitals have to meet. And Wexford currently, we are meeting our KPIs on what is classified as medical and surgical admissions. So we are within the KPI, but we do have a number of medical and surgical admissions. And sometimes that may be because somebody has gone home or gone home from ED because a bed isn't available. So it's something that you work on, and if you see that your numbers are going outside the KPI, then obviously that indicates that you have an issue, and you have to look at practice and look back and trace back to see what might have happened, or is there some other event or factor in that week or on that day that would have caused you to slip outside it. But there certainly is an issue with infrastructure and bed capacity to accommodate, I suppose, our growing populations and our ageing populations. And while the plan would be that people would be cared for as much as possible at home, there aren't always the resources there to do that, so that's a challenge.
One of the other criticisms levelled at the HSE and hospitals nationwide is waiting lists. But is it all about the money, or is it a deeper problem than that, Lily?
I think it's a deeper problem because, again, it's about, supply and demand, and the health services does operate within a funding level, but you also need infrastructure and capacity in order to see and treat and provide care to all patients presenting. So I think it's quite a complex problem. At times, money does come available to source services within private areas, and that does take some numbers off the list. But I think it's also around having the different diagnostics, the different care professionals, perhaps other methods of care as well, so that people can be seen quicker. So I think it is complex.
Now, it's been well publicised that there's a major problem in the health service today in relation to the recruitment of medical professionals. Is that problem still persisting in Wexford? And if so, what's been done to overcome it?
It is a problem and it's a challenge to us, and I suppose we try and meet it in a number of ways. We try and promote our hospital, we try and advertise permanent posts, we try and ensure that we have good teams working together where Wexford is an attractive place to come and work. We hope, because we have students going through the hospital, that they have a good experience, that they might come back, when they're going to work permanently. But we advertise in journals in the UK and elsewhere to try and attract clinical staff to hospitals. We have a big billboard at the front about our nursing staff, and that's worked really well for us. But basically we use word of mouth advertising, hoping people have a good experience when they come here as temporary or locums, and all sorts of other ways to try and ensure that we convince people that Wexford is a good place to work, that it's a good county to live in town, and therefore, this is a good place to have your career.
And what percentage of the roles that you are filling from a medical perspective are being filled by candidates coming from overseas?
It would be a small enough number in terms of probably around maybe 8 or 10%, but that would float up and down depending on different years. You can have in our health and social care profession or in our nursing staff, it would be very low percentage. In our consultants and junior hospital doctors, it could be slightly higher, but it wouldn't be significant. And
in terms of agency staff, how dependent are you on them?
We do depend on agency staff, in particular for short-term vacancies or in specialties where it's difficult to recruit. Our use of agency is significantly lower than other Model 3 hospitals, which is heartening. So we are still able to recruit a little bit better, but it is always a challenge. And I think agency staffing, they're very valuable in terms of short-term vacancies to support care. And I suppose they also provide work to people who may not want to work full-time or to have a constant commitment. So I think there'll always be a place there, and it does support the services, and they're essential at times.
How closely do you watch global trends in this sector? And is there any particular model hospitals that you take inspiration from?
A lot of the learning would be from the UK and from Scotland. There's a lot of communication at the moment. The Scottish healthcare system has gone through a lot of review, and they would be seen as being able to bring learning to, particularly in terms of Model 3 hospitals, where we are county district hospitals or rural district hospitals, and their models of how they work with community are interesting. And in the hospital group that we're in at the moment, we would have presentations from the NHS trusts there, and we're looking at learning. They use a lot of lean methods and trying to develop and improve services that way. So we've looked at that. We've also would have looked at Bolton Hospital in the UK, which is a hospital that would have been seen to have gone through a very good and validated improvement journey. So that's when you'd look at in terms of methods of improving, how you do things differently. But I suppose we're always looking as an individual hospital and as a group at where there are other ways of working. And the Ireland East Hospital group that we're part of are very integrated in academic development, in working with UCD in terms of putting research on this site. And we've just had the Clinical Academics Research Centre established here, and they are very into looking at what is best practice, even in the US and in Harvard, and learning from, I suppose, model healthcare deliverers to see how you improve services and meet the challenges which are significant coming down the Irish healthcare system, with the demand for care increasing against limited resources.
And Lily, finally, as we look out over the next 5 years, what developments would you like to see take place in Wexford General Hospital?
I suppose in terms of infrastructure, our principal one is that we have we're on the National Capital Plan. We have a project progressing for 125 replacement medical beds here on this site, and that will provide state-of-the-art single rooms, infection control compliant, for our care going forward. It would also go some way to meet the increase in demographics and demand on the hospital, which is reflected in the National Bed Capacity Report. So that would be our primary one, and I suppose we would very much hope to see that coming ahead in the next 5 years.
Well, if you've just tuned in, that was Lily Byrnes, the General Manager of Wexford General Hospital, and I would like to thank Lily for taking us behind the hospital doors to discuss the realities of running such a multi-dimensional organisation.
Southeast Radio's Business Matters with Karl Fitzpatrick.